forward to have you join us at 3D Heals 2020. So today is, a good opportunity for us to kind of chat, get to know a little bit about you. Could you maybe start by telling us your journey, how you started Xylyx?
Yeah, sure. Thanks for giving us the chance to talk with you, Maya. We're looking forward to the 3D Heals 2020 conference. A bit about myself. I'm a co-founder and the Chief Scientific Officer at Xylyx Bio. Xylyx Bio is a company focused on a platform technology around the use and the benefits of extracellular matrix. The idea that it's not the extracellular matrix, like one thing, but that in fact there are many different extracellular matrices. Xylyx Bio is the cell environment company. We're very conscious of the fact that cells in different parts of the human body live in radically different environments, and just like different humans around the world. And the way that they, function and behave is totally, reflected by and influenced by those environments. So whether the goal is, drug development, basic disease biology, regenerative medicine, tissue engineering, bioprinting, functional structures, whatever it is related to biology, the environment and the material is very important. And the approach that Xylyx has is one of sort of biomimetics. We aim to sort of take, what's natural, study how nature has done it. We like to say that our developmental pipeline is, hundreds of millions of years. Because we're working with the molecules and the environmental components that have evolved. Yeah, a bit about myself. I guess everybody likes a story. I was a struggling, depressed graduate student once upon a time in a tissue engineering, stem cell and tissue engineering laboratory at Columbia University. This is the laboratory for stem cells and tissue engineering. Directed by Dr. Gordana Vunjak-Novakovic. She's in some areas of bioengineering. She's a well-established and known entity. We were in a meeting, and I was focused on work related to cardiovascular and lung. Lung stuff, and we had a nephrologist just walk into the meeting. He walked over from the hospital because our lab is located at a medical center, and he said, this is the bioengineering laboratory, right? And you have the bioengineers here. I have a problem. I have these kidney stem cells, and I need to study them, and I need to see how they're responding in these different environments, and and I can't grow them in vitro. Help. And I think he sort of thought he'd walk in and chat with us for 5 or 10 minutes on demand, and then walk out with the answer. And it didn't exactly go like that. I mean, we chatted with him, and this was more than 10 years ago. It was this sort of embryonic idea that creating the right kinds of environments for cells is an important approach, right? For any kind of application where there are cells, living units outside the body. Yeah. And so this is where the journey really started. It started from a problem. It started from a need. And so from there, I mean, there's of course all of the laboratory legwork, all the sweat that goes into figuring out, okay, what's our approach going to be? How are we going to solve this problem? How do we establish a fundamental technology? And then from there, understanding and appreciating, I think, a hard lesson that, especially in translational worlds like bioengineering and 3D printing, we don't learn this in school, that technology is very different than products, right? Yep. And in some cases, there can be an enormous gap here. Like, we develop technologies in academic institutions. Of course, companies also develop technologies, but technology is like step one, and it can be an enormous step. But then there's a whole process of productization to
Right.
develop technology into essentially like monkey-proof usable products. And
Right.
applications in 3D bioprinting are a great example of that, because this is really complicated stuff.
Yes.
Uh, but to make usable products, I mean, to make products usable, you know, you have to have something that, like all the other, you know, like human primates around the world can, like, it's tools, right? It's just tool use. So it has to be, you know, clear enough, well established enough, reliable enough to be used. And
Mm,
that part is really tough. So actually, a large part of the journey related to Xylyx has been exactly that.
mm,
Xylyx started with a technology that came out of the university.
right.
It was driven by needs in the field and in the marketplace. And we have been on what continues to be a, actually at times, extremely challenging journey to find
Mhm.
out exactly what kind of products to develop and where we can bring them.
Right.
um, with a platform technology like Xylyx, it's a blessing and a curse, because um, extracellular matrix, as we say, is sort of quite literally the glue that holds together multicellular life. I
Mhm.
mean, it's relevant everywhere you have multiple cells clumping together and doing something coordinated, right? So that,
Mhm.
of course, includes pretty much everything that happens in the human body.
Yeah.
Um, so it's like relevant almost everywhere, right? So that's cool. I mean, there's something very compelling about that. But the flip side of that coin is, where do you even start? You know,
Right.
what's your strategic approach to get products that, you know, people perceive as valuable and that they will pay for?
Right.
Um, so that's another big part of the journey. And you know, plugging those kinds of novel materials into other novel tools and applications.
Mm,
You know, 3D printing is not such an old field, but better established than the bioprinting field,
mhm.
right?
For sure.
So yeah, um, there's sort of added challenges when you have new materials coming together with new technologies. You know, Xylyx has you know, partnered with the growing number of groups who are looking to do this or that type of thing with bioprinting.
Mhm. Yeah.
Um,
Mhm.
and I mean, we always start from the beginning, like, what's the goal? Who are we trying to make this for?
Right.
And then again, it's kind of back to the lab. I mean, we have to figure out how we're going to do that. So that's been a large part of the journey,
Mm.
uh, but it's very exciting.
Yeah, no, for sure. I think one of the biggest challenges with starting a new company is finding that product market fit, right? Finding the right customers and hearing and listening to their voices and making sure that you have a product that they can use and also affordable, right? So it's all about needs, costs, and whatnot. So I can imagine that it's been a really interesting journey for you. So yeah, we'd definitely love to hear more about this at 3D Heals 2020. So I know you mentioned you started kind of your PhD and postdoc under Gordana. What were some of the success or failures that you faced during that time that maybe sort of change your perspective of research or how you do product development? Would you be able to share, some of that experience with us today?
Sure. So this is related more to the academic, I mean, sort of my academic track. You're talking about sort of from academia into the
Yep.
industry space.
Yep. Mm-hmm.
Yeah. So I never meant to do any of this. I mean, my professional trajectory is actually still um, uh, intending to be geared towards medicine and medical
Mm-hmm.
practice.
Right.
I mean, there's a hand-in-hand fit here, because as a bioengineer by background, I mean, I was suckered into this PhD through actually the sort of single game-changing success we had. We had cobbled together a holy grail R01 application, which is this sort of, you know, you take a crazy idea, you know, blow it out as far as you can, and then submit it. Funding rate is, I don't know, like a, you know, single-digit % every year. And I mean, against all odds, I was actually headed to medical school at that time.
Mm.
Um, and against all odds, I mean, this project, that I had helped to seed with Gordana was selected for funding,
Oh,
and completely, derailed my plans. I ended up not leaving the lab and sticking around to pass the master's to do the PhD. Um, and one of the outputs of that was, this ECM, what
right.
we call tissue spec technology. The idea that different tissues have radically different extracellular matrix structures and compositions, which relate to tissue function.
Mm-hmm.
Um, so our whole goal, I mean, in thinking along those lines, is to line up with the sort of, where the medical world is,
Mm-hmm.
focusing on themes related to, specificity, precision, and personalization.
Mm-hmm.
So we take the same kind of approach with the ECM. Okay, so
Mm-hmm.
you're working with cardiomyocytes, you're working to engineer, functional myocardium. Well, okay, the specific environment you would need would be, heart matrix,
Right.
for example. You're looking to print aligned structures with cells and the material. Um, we've seen in sort of the static, manual pipetting studies that the presence of heart matrix can help with maturity and
Mm-hmm.
improved function of these kinds of cells. Yeah, so regarding failures, I mean, the path is littered with failures. I mean, it reminds me of these pictures you see of like the hikers on Mount Everest. I mean, there's like an oxygen bottle for every failure on this kind of path, right? I mean, they're everywhere. Um, the greatest, most successful scientists in the world have a fail rate of, like only 90% or 95%, right? The
Yeah.
rest of us are failing more than that, right?
Yeah.
Um, so, yeah, I mean, um, I guess maybe in thinking about past, grad school, after we, spun the company out, I would say there were even greater number of failures and learning curves and, tuition paid, navigating this. I think of this as like a hairball. I mean, you have this squiggly line
Yeah.
and this is where you are, and you eventually kind of get out of it, and it,
Right.
it's still rough, but you start moving forward, right? So, I mean, there's like an explosion of confusions and failures and, high points and low points in that
Mm.
process. I think
Yeah.
anybody who's been through the technology transfer process and the early stage, especially with a platform technology where it isn't like, a molecule or like a really straightforward device, like a
Sure.
cannula, or, I mean, then it's, yeah, you deal with this headache, you deal with this, Gordian knot that you have to navigate and detangle, and that involves having the flexibility and the willingness um, to admit when you're not on a path to success. I mean,
Mm-hmm.
to take a step back. I mean, to be honest with yourself and your teammates.
Mm-hmm.
We have generally taken a philosophy which is to have a very sort of Darwinian approach to our ideas, meaning soon as as soon as you conceive the idea, I mean, subject it to the most rigorous and critical. I mean, if you can throw an idea up in the air and everybody in the room can take turns shooting at it and nobody can shoot it down, then that's a fitting idea, right? That's a fit idea and it can move to the next stage.
Right.
Your whole goal is to fail as quickly as you can,
Absolutely.
right?
Mm-hmm.
That way you're not spending time, getting further down the road for something that ultimately is not destined to be successful.
Right.
In a bigger picture, I mean, the bioprinting world has lots of application areas. Regenerative medicine and whole functional tissue or organ engineering is one sort of, holy grail area. I have been increasingly thinking about other areas of technology development and, gaining inspiration and perspective from that. I think that, for example, the field of aviation is a good example of this. 100 or so years ago, I mean, or maybe it's a bit more than that now, a little more than 100 years ago, you had a couple of brothers, uh, uh, somewhere in, I want to say it was North Carolina,
Mm-hmm.
who were standing in the field and looking up at the birds and wondering, how can we, get up into the air? How can we fly?
Mhm.
And this was a radical idea, right? They these Wright brothers worked together and remarkably got logged the first flight, right?
Right.
Um, Only 60 years later, I mean, at the time, the Wright brothers would have flown over the cornfield or whatever they flew over, and sort of looked down and gone, wow, and like looked up at the moon and said, well, the view's nice from up here, but the moon is not even conceivable, right? And only 60 years later, I mean, humans were, in orbit and landing on the moon. I think this whole bioprinting world is sort of at this, Wright brothers kitty hawk phase,
Mm.
where we're trying to get above the cornfield.
Mhm.
Um, Engineering the whole organ is landing on the moon, right? Or at least, complex functional tissues. It's
Sure.
very different to engineer, a bit of bone, which is already phenomenally difficult.
Sure.
Um, but this is very different in engineering, like a functional bit of liver, right,
Sure.
which has
Sure. Yeah.
all the additional metabolic requirements. So to that end, I mean, you can be working on this very, very long, ambitious timeline. I mean, there's a million ways to go and only a limited number of routes to really move things forward.
Right.
So you want to fail as soon as possible. The other area where bioprinting can be very helpful, of course, is to accelerate drug development. It's a sort of
Right.
parallel path, right? And
Absolutely.
again, I mean, yeah, the big picture there again is pharma companies spend years, and like I think on average now $2.5 billion to
Right.
get a drug approved.
Yep.
I mean, that's another path that's littered with failures. So the sooner that you can identify fails and pull them out, you save time and money. Things move
Sure.
forward more quickly.
Absolutely.
So this is the sort of, I don't know, insights I've learned through my own journey,
Mhm.
and I always find it helpful, inspiring, and a little reassuring that other people have struggled just as much or more. I mean, we're not
Absolutely.
alone in this, right?
Yeah. Absolutely. Yeah. No, I think that's, I think part of building a community around this is also sharing our failures and successes together, right? And with every failure, there is always an opportunity ahead, something that you learn to move the field forward. So I think that's really one of the great things about being able to share all this knowledge together and move the industry forward. So yeah, for sure.
Right. Yeah, Maya, I would actually echo that loudly. And actually, this is a sort of not complaint, but just like observation I've had. In the scientific literature, at least in the sort of the biomedical literature, I mean, we tend to only focus um, on things that worked, right? And you
Mhm.
only report the good results, and you pick the best representative
Mhm.
photo, and whatever it may be, results, right? And
Yeah.
so we have this curated set of information, a massive set of information in the literature, but it is actually, I would consider it probably like it's the one pizza slice out of the entire pie of results.
Yeah.
And I always wonder like how many failed things have been done many times over by many different people. I mean, if there were like a journal of failed experiments where people could just
That's
say, well,
right.
now we know this doesn't work, right? I
Yep.
think what you said about sharing and recording failures, especially at the early stage for fields
Mhm.
like bioprinting, I think this is actually really important and not something people are inclined to do. There's no
Right.
shame in failing. Everyone fails, right?
Absolutely. Hmm.
The more you build up, like I don't know, I mean, the more you build up, I mean, without taking like, I mean, de-risking every single step, I mean,
Sure.
you can be working towards a really um, you know spectacular failure, right? which
Yeah.
which you want to avoid, right? You want to have unremarkable, quick, small, fast failures, right?
Absolutely. Yeah. No, for sure. For sure. That's great. Yeah. No, I think there's a lot of things that we can all learn from each other. So that's definitely something that I think will be good for us as a community to continue sharing. I guess knowing what you know now, would you do things differently if you were to go
uh,
back 5 years ago?
uh, of course. I mean, my personal kind of philosophy is, I mean, if you're not looking back at your papers and your studies and your results and you're outputs, performance. I mean, if you're not looking back at that, and I mean, I look back at a lot of stuff and just cringe and go, oh God. I mean, if you're not looking back and thinking, man, I could have done that better,
Right.
then you're not growing, right? I mean, the day that you look back and go, man, there's no way to, I mean, there's no way to do it better than that. I mean, that would be a worrying day for me. I mean, there's especially, you know, with these embryonic type technologies. I mean, we haven't worked out all the bugs. We probably won't for a long time. Maybe we never. It's these ongoing optimizations, right? So, yeah, I mean, I'm always looking back and thinking, you know, how could we have done that better? You know, make notes. It informs the next time, right? That's actually why the failures are so informative, right? You can learn a lot from a fail.
Yeah, no, that's a very good attitude, and I think definitely, you know, everybody can learn a little bit from the missteps, right, that they have, and take it to improve themselves or improve the group into a better place moving forward. So that's great, awesome. Well,
there was Maya, one last thing to share. There was I just share this because this story struck me. I mean, it came from someone like one of our advisors. I mean, this was like not a recent story, and I mean, it may be folklore. I don't know, although I'm sure something like this has happened.
Yeah.
He said, you know, oh, I had an old buddy of mine I used to work with, and you know, he was in charge of some, I don't know, investment fund, or he had some multi-billion-dollar thing, and you know, it failed spectacularly. I mean, he lost like $1 billion or something,
Right.
not of his own money, but of the firm's capital, right?
Sure.
And then, of course, because because the money went away, the group went away, his job went away, right? I mean, he wasn't fired. It just, he no longer had a position, right? People were standing in line to hire this guy, you know, in the next round, because I mean, there was this perceived value that because he had been through this epic failure, he would know exactly how to avoid it next time. Right?
Sure.
So yeah, weirdly, this turned into I mean, one theme that emerged here was, I don't know all about fails, but I mean, the point is that there's enormous value in that, and you know, I think this has been a helpful attitude for me, at least on my journey. Yeah, not something to be covered up, something to be shared, discussed, analyzed, and used as fuel for the future.
Yep. No, definitely. That's the right attitude to have, for sure. That's awesome. Great. Well, thank you so much, John, for your time today. You know, we're definitely looking forward to continuing this discussion at 3D Heal 2020. So I'll see you then, right?
Sure. Thanks, Maya.
All right. Thanks.
Bye.